Hi, Larry Du Bois here. This is a little bit different kind of video that I'm going to put out. I am going to show you how to inject a drug into your stomach. This is the drug Lovenox. It is a anticoagulant, or what we would call blood thinner. I have what's called DVT, deep vein thrombosis, which most people would recognize as blood clots. I could go into a lot of stories about the blood clots. I've had them in the past. I got a whole history of it. This is the second time I've been sent home with this particular drug over the years to self-administer at my house rather than staying in the hospital. A lot of times when the blood clot moves up from your lower leg, your calf, into your thigh, a lot of times they want to hospitalize you just from that, because it's very dangerous if that were to creep up and go into your lung and cause a pulmonary emboli, which is probably about 30% mortality rate on those. Also, there used to be a drug called heparin, and they use that in a hospital setting. But they got this Lovenox now, and I got the generic form of it. But I'm going to show you how to inject it into your stomach, because I've seen some videos on the, by medical professionals, and they take a lot of time to go through a lot of stuff. It's too sterile, if you ask me. No pun intended. But basically, I have blood clots in both my legs, and so I stopped taking my oral blood thinner, and I'm going to show you. Now, I also have compared is a insulin pen, because I do that, and it's very easily for someone who uses insulin pens or injections to shoot this other drug into yourself. I remember the first time I went home with it, when they said, well, you can go home if you think you're capable of injecting yourself with this, Lovenox. And I says, yeah, I can do that. I'm a diabetic, no problem. And so, well, I get the medicine, I get to the, home, and I realize the syringe on this thing is like twice as long and twice as thick as a diabetic needle. And I was thinking, oh man, that's going to hurt or something. And that's what most people are afraid of, is some sort of pain. They're afraid of putting a needle in themselves. It gives them the willies, if you will. But I wanted to show you because it really doesn't even hurt. I mean, and of course, if you compare it to a diabetic pen needle, you can hardly feel these. In fact, there's really no pain involved, to where you almost wonder, did this shot go in? Did I actually, was I successful? Because you can't really feel it. And so that's one of the things. But I'm going to pause the camera a minute and get it down here in position so you can actually watch me. So stay tuned. Okay, I got the camera dangling here, so hopefully it won't fall off. First thing I'm going to do is I'm going to take an alcohol pad and I'm going to clean the area. Normally when I use my diabetic needles to shoot a shot of insulin, I don't usually do this every time. That's just me. I've never, got an infection or anything like that. Do what you will. Sometimes that stuff's overkill. Right now I'm going to put a needle on my diabetic pen. I just want to show you this. I don't know if you can see the size of that needle on the camera there compared to my backdrop of my shirt, but that's how big the diabetic needle is. And they come in different sizes. And you just dial this up. So I'm going to take 10 units. I don't want to get into all the measurements right now, but I'll just stick that in there, and you just kind of make a straight poke. Inject the drug, and it'll stop. And then you leave this is key, I think, you leave the needle in there. I was told by a doctor once, leave that in there for a few minutes and make sure that all of the medicine seeps out from the needle into your skin. And then you can just pull it straight out, and you're done. That's that's my insulin pen. It's Lantus. Well, actually, it's not Lantus. It's vascular. It's a long-term insulin. There's so many different insulins out there. A lot of them are the same. They're just a different brand name. So we're going to go ahead now, and I'm going to take, I got 2 syringes of different milligrams of the Lovenox. I'm not even sure if I'm pronouncing that right. I'm going to take this first one. Just make sure if you got 2, one's yellow and one's purple. don't use 2 purples or 2 yellows. You'd get it wrong. You know, don't get that mixed up. So I'm going to just use the yellow one. This is, I think, the 40 milligram. So as you can see, it's a much bigger unit there. The cap, I'm going to pull the cap off and set that there. It's got quite a longer needle, not so much bigger around. You think it's going to hurt or something, I'm just going to go ahead and poke that into my stomach, straight in. Slow and steady with the handle of the syringe. I don't know if you could see that. My hand's in the way. Just sort of push that in, the plunger. Let it sit there a couple seconds. And again, so that when you pull it out, you don't see medicine squirting out of the needle or running down your skin. Then you want to make sure you get all the medicine in there. That's the purpose of this. So now I pull that out, put it in a Sharps container or an old milk carton. I'm just going to put the cap back on. I wouldn't recommend doing that if you're going to put it right in the container right away, because they can poke through that thing and hit your finger. That doesn't feel so good. And that's the part that hurts, not the shot. It's all the extra stuff. So now I'm pulling out this other one, the purple one. Again, it's similar. It's got a different colored plunger, and hopefully you can get a better shot. So I'm going to pull this off. It's a little stiff. Set that up there. Again, the needle. The bubble in there or whatever, don't worry about that. Just put it right in there, and ooh, you can rotate that around your stomach each day if you got to do it for a week or so. So I push that in there again, and again, got it all in there. I'm letting it sit for a minute and pulling it out. Yeah, you don't have to worry about the air bubbles in there because you're using it subsequently. I can't even pronounce the name. Skin, you know, it's putting it in your soft skin. If you were putting it in a vein, you'd want to get the air bubble out of that. Unfortunately, I used to be a heroin addict, and unfortunately, I know a lot about needles and veins and stuff. But that's it. That's basically it. A lot of people are saying, oh, it's gross. Now you got a little blood there. It's not a big deal. That's very rare, actually. Sometimes when you hit a new spot where you're not usually in the same area, it can cause that for whatever reason, cause blood. I wipe it off with an alcohol pad, and you're done. And so my big hairy stomach, you don't have to look at anymore. But that's it, basically, a how-to. Again, just one more little plug for insulin. If you're a diabetic, I know this video is mainly for this blood thinning medicine for people that have to use that, the Lovenox, for blood clots. But if you're a diabetic and insulin is the best treatment for your diabetes to be under control, don't let the fear of needles or the fear of shots stop you from getting that treatment. I'm going to go ahead and raise the camera up so I can look in the camera. Don't be afraid of that, because it really, the only time it stings a little is if the alcohol, you know, gets in the hole where the needle went, and just, you know, it's very minor. I mean, it doesn't even, I wouldn't even call it hurt, but it doesn't hurt. It may give you the willies, but it's worth the treatment. Don't let that stop you, because they've shown now where diabetic number 2, onset diabetes, is best controlled. If you can't control it with diet and pills, it's best controlled with insulin. And so don't be afraid of using that. Rather than have your blood sugar be high constantly, that's more dangerous. Giving yourself shots is no big deal. But that's how you do it. Anyway, hopefully I'll have more helpful tips in the medical stuff. I've been through a lot of medical things, so I can relate. I do have a little bit of medical knowledge. When the nurse came out here to do the to watch over me with this stuff. I thought, well, I know how to do it, and they were asking about my diabetes, and it's been under control for several years now. Doing really good with that. And I've had diabetes over 20 years, and so they're giving you these little booklets on how to manage it, and I'm thinking, I could write my own book. I could teach my own class on it. So I'm also aware of medical things, but I also have gone through it myself, And so a lot of times doctors will tell you things and they've never experienced it. Unfortunately, that's, it's good for them. They haven't done that. But anyway, hope you enjoyed it, and check back for more tips. Sometimes they're tips on cooking or something else for bachelor living. So anyway, God bless you. Thanks for watching.